Welcome to the third listed medical doctor onboarding webinar organized by Cloud Clinic. This webinar is titled Adapting to Changing Demands in the Healthcare Industry. My name is Ololade Olaleye, and I am your host for on the fence about becoming a listed medical doctor on the Cloud Clinic app. I can assure you that you will be convinced to do so at the end of this webinar.
Everyone, my name is Ifeanyi from Lagos. I think that's our modus operandi here, your name and where you're coming from. Let's keep that coming. So I'm happy for us to get started today. This is our very third onboarding webinar online event for medical doctors. And we've really, over time, the past two ones, and even the ones we've done with our partners, got a lot of information and feedback, and we're constantly improving the process. And today we have some very interesting announcements for you, which we believe will be interesting as well. But I want to start first of all, for those that don't know this yet, talk about what is Cloud Clinic, right? So Cloud Clinic is a service, is a platform we've created in light and height that is geared towards making it possible for doctors to be able to consult with their patient from anywhere in Nigeria. But beyond that, we're also partnering with different medical labs, pharmacies, and reference hospitals to make sure that that process is a complete process. So what do I mean by that? When you're consulting with a doctor, with a patient, and you're trying to find out what is wrong with that patient and trying to get his health better, we're working with med labs and pharmacies that are close to those patients to be able to complete the entire process. In the course of this webinar, we're going to be able to help you understand how this works in detail, right? So we talk about the vision that really drove this company and made us who we are today. So first of all, we started with saying that we're providing access to quality healthcare for everyone anywhere in Nigeria. Now, this is a very bold vision, and we understand that it's not something that comes easy. To say that our vision is to provide quality healthcare to everyone anywhere in Nigeria is quite a bold statement, but we do believe this is possible. We believe in the mission that we have that is helping us achieve this. The mission talks about how we plan to achieve this, and what we believe is that we're engineering the future of healthcare. The screen talks about our partners, and truly our partners are our strength. So one of the things we've done is we're partnering with different medical labs and pharmacies, and the list you saw in front of you is just a small number. I think we have close to 80 partners today that have signed, put pen on paper with us even before our launch. And that at least close to 800 to 1,000 more partners are reviewing our agreement and are in different stages of signing.
So I'll touch a bit on some of the key features on the Cloud Clinic app and also what you can do with them. Features in the Cloud Clinic app is native languages. All right. We understand that today there are people who we are servicing the whole of Nigeria, and there are people who might have different languages that they feel comfortable speaking with. So one of the options that we've done in the app is such that as you're a listed medical doctor, you can indicate the languages that you're proficient in. For example, if you're proficient in Igbo, Hausa, and Yoruba, you can also indicate that when registering or applying as a listed medical doctor on the Cloud Clinic app. Also, we automatically match you with patients who either are proficient in same languages or who request to speak to you in their native language. So as diagnostic and pharmaceuticals, Cloud Clinic offers a wide range of diagnostic and pharmaceutical options through our partners. All right, so the Medical Knowledge Center, which is an interactive medical hub, we've made it exciting such that the Medical Knowledge Center, articles that are posted by doctors on the Medical Knowledge Center can also be shared across different platforms by the patient. And we have our location-based service. Our location-based service is unique such that we give our patients turn-by-turn navigation to our physical healthcare service payments. So for seamless payments, once you've applied and you've been approved as a listed medical doctor, automatically you have a wallet that has been created for you on the app. All you have to do is set up your bank details so that you can access your funds. And one other beautiful thing is that on our platform, you don't necessarily have to wait till the end of the month. So you can access the money from your wallet anytime, through the Cloud Clinic partner.
Talking about the house rules, I want to start by welcoming us to Cloud Clinic Limited, which is a healthcare company that is engineering a platform that connects different players in the health field. The instructions in the house rules, they actually are there for us to follow. We encourage the listed medical doctors to observe the code of conduct. Concerns regarding any of the house rules should be emailed to houserules@cloudclinic.ng. So at this point, it's a hooray period because we are happy to announce that our launch date is on the 18th day of April 2023, just less than a little above 2 weeks. Questions from the doctors, and we decided to put it up here. This might answer some of the questions bugging us as this webinar is progressing.
Good afternoon, everyone. This is Dr. Dele. To begin with, I'm excited. I can't wait to come on board. I begin to have consultations online